But if you look at the health report, it really breaks down the status of our older adults year by year. One thing I do want to point out, it says food insecurity was down by 16%. And you look at, this was during 2022 or reporting the previous year, and that was a COVID year. So a lot of these coverage programs have now expired. So that really helped with food insecurity. So we know that food insecurity is likely, going to worsen now that we are hopefully towards the end of COVID, but definitely out of the worser part of the pandemic. But we look at, so many of our older adults that you all are taking care of, nearly 1 in 3 have severe housing problems. So they might actually live in a home, but perhaps the home is really in need of repair, which repairs can be expensive. Good news, geriatric providers are up 13%. And flu vaccination up 6%, which is really great because we know that the flu can really be problematic for our frail older adults. And then preventable hospitalizations are down 6%. And, I give kudos to all of you, my APRN colleagues here in geriatrics. A lot of that has to do with the hard work that we do, especially in long-term care. And the data is showing that. And we like the fact that all of these outcomes are being published. But most importantly, our older adults are really suffering less because of the work that we're doing. So when we're looking as GAPNA, our overall policy priorities, of course, it always comes back to care of the older adult. And we want to engage in opportunities that promote the role of the APRN, as well as those that remove barriers to practice across diverse settings. So you're going to hear from Kim about some of these priorities and things that we have been active in this last year. But really, these are the two components. We want to, as a Health Affairs Committee, make sure that we are doing things as GAPNA to promote the role of APRNs, our committee, our members in GAPNA, as well as working on different things, different advocacy pieces for all of us as we continue to try to break down those barriers so that our patients have equitable health care.
Thank you, Jenny. And I'm Kim, and I'm going to dive a little bit more into what GAPNA is doing to promote these roles and these policy priorities. And to promote the role of the APRNs, we really need to improve access to the Medicare skilled nursing as the public health emergency waivers. Through COVID, we were able to break down some of those barriers, but unfortunately, these waivers end. And we need to prepare for the end of all of these public health emergency waivers and really, break down the barriers, get rid of this red tape so we can continue to do admission H&Ps for our skilled nursing and our regulatory monthly visits. We know that this is a delay in care when we cannot be the one out there doing that. We've been doing it, but it's just really not been recognized. So we know this is very outdated. How many of you are struggling with this now? Yeah, many of this. So we need to really now jump on this. The time is here, and at a federal level, we need to be pushing this so this can continue for us to take care of our patients. We also need to remove barriers for certification for hospice. I know many of you are also struggling with this. This is delaying care. I've heard, and many of y'all could tell me say stories, and I've heard terrible stories about this delay in care for hospice when they need it, and yet we cannot be the certifying person to order these hospice services. GAPNA is involved with a coalition of 12 organizations. They're collecting data because we know that data is powerful to get policies changed. So getting that data is important to develop and publish policy statements, and white papers. So we really need to amend the action, is to amend that Social Security Act so we can certify Medicare patients for hospice care. It's very important to our benefit of our patients. For the geriatric workforce, GAPNA has been involved in promoting the gerontological specialist certification. Many of us here are certified or will be taking that test soon. Buy your book. It's fabulous if you want to have that as a study guide. So we need to close that workforce gap. So certification, facilitating training for interprofessional teams, and also supporting the caregivers as they are an important member of the team to care for our patients. Some federal money has been shifted towards assisting our older adults. These are infrastructure bills mainly from 2021. But statistically, we know that about 70% of our older adults will require assistance in ADLs and IADLs, those daily needs. They're going to need that, we know, for possibly up to 2 to 4 years. And as we've heard many times, we have this growing older adult population, the 85 plus. This need is going to rise dramatically. According to AARP, the family caregivers, they're supporting and devoting about 24 hours a week right now to their loved ones. And they're spending a lot of money out of pocket, around $7,000 a year out of pocket to support their loved ones. And they need help. If we're going to make this shift to keep our older adults at home, we have to have the federal money and infrastructure to support it, because the caregivers cannot have the time and money to try to do this on their own without help. The next one with the Biden Inflation Reduction Act, I think most of y'all had heard about this. This is kind of hot off the press. It was signed into law on August 16th. It's a really broad range of health and tax provisions. It will reduce prescription drug costs for Medicare and reduce drug spending by the government. They will take effect in 2023. They are looking at capping Medicare beneficiaries' out-of-pocket spending under Part D, actually limiting cost of insulin to $35 per month for people with Medicare in 2023. It's definitely not perfect, but it is a good start. So we're hoping that this will continue to expand eligibility and give more relief to our older adults. Some federal legislation bills, the Comprehensive Care for Alzheimer's Act, that is asking the Center for Medicare and Medicaid Innovation really to look at what is a better payment model and structure for dementia care management. We know that we need care plan coordination, navigation, caregiver education, and support. We need to ensure the patients have access to interdisciplinary team, because we know that's going to be better care, and we need to be able to reimburse our providers and us with maybe an incentive payment plan on performance. So also the palliative care. We need to work on expanding that access, and again, it's looking at what is a model of care that we can do as a community-based palliative care model. So we've had some wins with some federal legislation, and some we're still working on. Diabetic shoes. We have been working towards ordering diabetic shoes. I don't even know how long this has been going on. We still can't do it. I mean, really, this is kind of ridiculous. But we did have a win with the cardiac and pulmonary rehab. So that legislation was passed in 2018. So PAs, NPs, CNSs can supervise and cardiac and pulmonary rehab. So although not all is good, we have had some wins and seen some great changes that I think maybe we can start getting this tide to turn a little bit more.